Good morning. I'm told that we finished the digestive abnormalities, conditions that affect the digestive system, and the last one, which we looked at, were the worms. And so this morning we are to start CORYZA. We are starting the conditions that affect the respiratory tract infection. And when you look at the respiratory tract system, we are saying it's the nose, we have the lungs, the trachea. All those are the systems that make up the respiratory tract, and we have different ailments that affects the respiratory system. One of which we are looking at this morning, we'll look at the CORYZA, which is also known as common cold and CORYZA. Okay. So objectives, we are saying at the end of the lesson, students should be able to define CORYZA and hay fever. So we are looking at the two conditions. We are looking at CORYZA and hay fever. So by the end of this lesson, we should be able to define those two, CORYZA and the hay fever. Then we should be able to outline the predisposing factors of CORYZA and hay fever, mention signs and symptoms of CORYZA and hay fever, and also discuss the management of the two conditions, which are CORYZA and hay fever. So, as stated earlier, we are saying CORYZA is also known as a common cold, okay? It is an infectious acute inflammation of the mucous membrane of the nasal cavity. It is caused by rhinoviruses that invade the upper respiratory tract. So when you look at the upper respiratory tract, that's it, before the lungs, okay? The nose, going down the trachea, those are the upper respiratory tract. And so we are saying what causes this CORYZA is a rhinovirus. Okay. So it is the most prevalent infectious disease and is spread by airborne droplets emitted by infected person while breathing. So this CORYZA, we are saying it's infectious and it's spread through airborne air droplets that are emitted by the infected person while breathing. What are the signs and symptoms of this CORYZA? One, irritation. There will be an irritation of the respiratory tract, okay? Then sneezing, dryness of the nose or nasal pharynx, they will be dry. Then we are saying nasal secretions, those are the signs. Some nasal obstructions, elevated temperature, headache. These signs and symptoms last for about 5 days to 2 weeks. So you notice that when you have CORYZA, these signs, the obstruction, elevated temperature, running nose, those they may last for 5 days to 2 weeks. Then what is the medical management medical management for CORYZA, as we are aware that viral infections have no much treatment, okay? So treatment for this is symptomatic, meaning you treat whatever comes, okay? Whatever symptoms come, you may need to look at that and treat it. Give nasal congestants. If we are told that there will be congestion in the nasal, okay, then you need to give nasal congestant. And what type of nasal congestant you give is ephedrine, which is adrenaline, okay? You can give ephedrine drops as a nasal congestant, okay? Also give analgesics and antipyretics. You can give analgesics and antipyretics because we are told that there will be fever, okay? The temperature will be high, hence you may need to give those analgesics and antipyretics, okay? So, nursing management, we are saying give warm salt water gargles to soothe the throat, okay? Warm salt water gargles will soothe the throat. Advise the client to avoid the crowded areas, okay? As these areas may be the source of infection. Then cover the mouth with a flexed elbow when coughing, okay? You can either use a flexed elbow or a tissue which you can dispose of as soon as you use it. Ensure hand washing to prevent spread of upper respiratory tract infections. Then encourage fluid intake to liquefy secretion. You advise the client to take a lot of fluids. Then encourage bed rest. Bed rest is very vital, okay, to help in the recovery. So now, let's look at the complications of CORYZA. Complication, we are saying otitis media. Otitis media, you find that because of the proximity and the connection between the nasal cavity and the ear, then the infection may spread to the ear, okay, through the eustachian tube. Then you find that the infection may go to the ear. Then sinusitis, that's inflammation of the nasal sinuses, and also lung infections such as pneumonia may come in because of CORYZA. Any question so far? The other condition we are to discuss is the hay fever. Remember, these are small conditions that affect the upper respiratory tract. So, hay fever is also known as the allergic rhinitis. So, hay fever, this is the inflammation of the mucous membrane of the nose. So, the mucous membrane of the nose will become inflamed, and it is the most common type 1 hypersensitivity reaction. So this, as it says, it's allergic, okay? So it's a hypersensitivity, a most common type of type 1 hypersensitivity reaction. It develops due to an allergic reaction due to certain substances. One will be allergic to certain substances like pollen, protein, animal fur, dust. Those may cause an allergy. Okay? This occurs in people who have inherited very high levels of immunoglobulin E. Immunoglobulin E. So these people who have inherited very high doses of immunoglobulin E are very susceptible to this allergy. So when exposed to allergens, we are saying these high levels of antibody activate basophils and mast cells which release their granular contents, histamine. So when one is exposed to allergens, okay, of high doses, the antibodies will be activated, and these antibodies would activate the production of the basophils and mast cells. These mast cells, they are anti-allergens, okay? Then, because of that, they will produce histamine, okay? They will release their granules that contains histamine. We are saying that histamine constricts the smooth muscles, these smooth muscles of the airway, okay? And this will result into vasodilatation and exudation of fluid and protein in the tissues, okay? There will be vasodilatation because of the production of this histamine. Then this histamine will work on the airway, smooth muscles, and these smooth muscles, there will be vasodilatation and exudation of fluids and protein to in the tissues. So, what causes this? The causes of hay fever, we have grass or wheat pollen, irritants like dust, feathers, tobacco smoke, industrial chemicals. All these may cause hay fever. Okay? Then let's look at the signs and symptoms for this hay fever. We are saying signs and symptoms of hay fever include some of the include rhinorrhea. So signs and symptoms of hay fever, we are saying rhinorrhea, which is excessive water exudates from the nose. So that is what they call running nose, okay? That is rhinorrhea. Then sneezing. The person will be sneezing. Then excessive secretion of tears. Knowing to say that there is a connection between the nose, eyes, and the ear. Okay? So you have those connections, hence you realize that then there will be excessive secretions of tears. Okay? The other signs of and symptoms of this hay fever include itching of nose and eyes, itching of throat. You feel the itching of the throat and also the itching of the nose, itching of the eyes. Okay? Then there will be congestion of the nasal cavity. In the nasal cavity, there will be congestion. How do we manage this hay fever? We are saying the management of hay fever is, first let's look at the investigation. You take a history and the skin test to confirm if the patient is hypersensitive to allergy. So history will tell you that this person has been having this problem because he went through a field, okay? A field, or when it's windy, then he experiences such things. So, will be hypersensitive. And also you do a skin test to determine the allergy, okay? Then medical management, we are saying you use antihistamines such as Phenergan, which is promethazine, to help relieve symptoms, okay? So this promethazine can be given orally or via injection. What you are trying to do is to relieve symptoms, okay? You want to relieve symptoms, you can give this Phenergan. The dose you can give in adult, it's 25 to 50 milligrams you can give. The side effects of this Phenergan, the person will feel drowsy. Drowsy, there will be nausea. Okay, so those are some of the side effects. You feel sleepy. Okay, then the other type of drug you can use is steroids. Steroids nasal spray, which counteract the inflammation. What you are looking at is there is an inflammation there. Then you want to counteract this inflammation, you give a steroid. Okay?